Okay, my question is mostly for Dr. Miller, but Dr. Pamplin, you just touched on this a little bit, which is using data that are not necessarily designed for health research in health research, and some of the issues that, for instance, like I'm trying to use like publicly available school quality data, and a lot of the questions I get are like, how are you validating this? Like, how do you know if this is measuring what you think it's measuring? Are the measures reliable over time? And I'm just curious, like, especially with the 311 data, like one of the categories was like public health related. And I'm just curious, like on the 311 side, when they're collecting those data and categorizing them, is there some systematic way that's happening? Has that been validated? Is that a concern for your study? And do you have any best practices for using, quote, found data for health research?
Yeah, that's a very good question. I'm not gonna have a very good answer to that, but I can tell you what some of the things that we've done. The map I showed you where we formed clusters of 311 data and then compared their socioeconomic profiles, that's not a test, of anything. It's just kind of a qualitative assessment. Are we seeing different signatures from different socioeconomic, profiles in neighborhoods? So it gave us like a gut check, as I said, that we've seen that 311 data seems to be measuring neighborhood distress, but it certainly isn't any type of statistical test. And I think this is a big issue, a big research issue for this community and also other communities, because there's all this found data out there, and we have to be concerned about like the sampling frame, like who is submitting the 311 request. We know the neighborhoods, and we know what they're about, but we don't know like who the people are who are submitting the requests, and that's essentially like a sampling frame problem. But the general problem here is that we have these novel sources of data, and we want to make sure it's scientifically valid. We also want to make sure it's valid for policy and planning and laws. So it has to be authoritative in the sense that you could, it can pass like legal and constitutional muster, that this data is reliable, the fact that you can make law changes, policy changes, resource investments, and it could stand up if it's challenged in court. That is, when I've talked to people in practice, both in public health and in my area, which is mostly transportation, they say that we'd like to use novel data in order to guide where we're going to do investments, but we have to make sure that if we use that data for decisions, if we're sued, we can back up what we're saying, and that's a really, I think, important open question for this and other communities that want to use found data. So I told you I didn't have a very good answer. I just think that's a very researchable question.
There's a question here in the front as well.
Hi all, thank you for this extremely generative talk. I think having you all on one panel also is really helpful for this question. That's motivated Dr. Miller and Dr. Pamplin's work, but interested in what you all have to say. The first, they're both ethics questions and also empirical questions. The first is around the ethics of identifying clusters for something that is illegalized, right, is criminalized. That obviously in public health, the goal of cluster identification is to target resources, but we know in this era of algorithmic policing that those clusters are also used not to target care, but to target punishment. And so to think about how, especially when part of our, well, that's part two. So that's one question. The ethics of this communication and to whom you're communicating and around publishing it. And the second ethics question, which is related, is about the inputs to these measures, especially either human rated or machine learning rated, which we know have incredible racial bias. This paper almost 20 years ago on seeing disorder that you put a picture of the same neighborhood, you switch what person is in front of it in the image. If it's a black person, raters from many different races have a dramatically different assessment of that neighborhood's quote unquote disorder, especially when we're asking people to rate beauty, for example, or calm. How do you think about the deep biases, not just inter-rater reliability, but like if every rater has a ingrained societal bias, how do you think about dealing with that?
Do you want to start or should I?
So I will try to start. I think that, So communicating this work and the ethics of it, I think it's a dual-edged sword, at least the way I think of it, is I often think about the flip side of not studying these type of questions out of fear that it can get kind of interpreted the wrong way or taken by the wrong person. And then that's just furthering the idea of not studying, problems that are impacting specific groups, right? And I feel like that's an injustice that I don't want to contribute to either out of that kind of fear. And so I don't have a great answer other than just having to then try to be very thoughtful about every decision I make from there. I think in the context of, clusters in policing specifically, I'm less concerned about that in this, because it's the flip side, right? No, you're already targeting these groups as opposed to me telling you that and I want to highlight that showing kind of policing or arrest is not the same thing as showing unlawful activity, right? In fact, we've actually, not just my group, but a number of studies have shown that part of what motivated this is, at least in New York City, crime, racial ethnic density was one of the biggest predictors of policing presence even after adjusting for the crime rate across the city, right? So I think it's, I guess I'm less concerned because of that, but I do agree, especially in other work that I do around drug policy and things like that, it is something that we have to be really thoughtful about how we approach.
If I can add to that about drawing on the drug policy issue, that's something we've actually been thinking a lot about. So with a local harm reduction laws project, we initially had this plan to do a database, openly available database, mapping out all the laws for all of these municipalities and making it publicly available to everybody, around the country. And now we're actually rethinking that, whether that makes sense right now to make that publicly available, given all the threats that there are to harm reduction laws, and whether, just publicizing the status of laws in different municipalities is going to put certain municipalities under threat, call attention to them. And so while we are still going to do the research looking at the effect of different laws, we're probably not going to make the data publicly available. So I don't know if that's, continuing, I think with some of the same themes you were saying.
Yeah, and if I'll add to that, when it comes to identifying these clusters, we did that project in a very community-embedded way. We started with the opioid overdose, prevention community in Columbus. And one of the things that we were concerned about the use of our results to do predictive policing. That was one of our main concerns. And we did always qualify our research to this community by saying this is not a tool for predictive policing. We purposely steered conversations away from anything like that when we were talking about the implications of it. So it is a concern, and it is a double-edged sword that we want to make it, advances in our knowledge and then our ability to formulate interventions, but we do have to be worried about that kind of, ethical issue. So we tried to, when we work with the community, we tried to kind of put bounds around what we're doing, and hopefully we're successful. Regarding the image classification, the place pulse images I don't think contain people in them. The people who rate place pulse images, this is I forget, tens of thousands of people around the world. There's something like millions of these ratings, so that doesn't mean there's not biases in it, but it's not just like white people in the United States doing these ratings. So that doesn't, again, it doesn't necessarily take out all the biases, but that's one thing that makes that quite robust, I would say. In terms of the image segmentation, when a person was identified, it only identified them as a person. So we didn't really have a attribute to associate with the object person. But your general concerns are very valid. There are biases in all these machine learning approaches, which are based on the type of data that's been fed to them, and we do have to worry about unintended consequences for our research, and we just try to do it in a sensitive way and in a way that we're embedded with the right community, shall I say.
All right. There's a question all the way in the back by the wall.
Can we get a microphone? Yeah.
For Dr. Cerda. I'm Lourdes Cerda with the National League of Cities. Nice to meet you, presenting Thank you.
So your research highlights how most harm reduction policies like naloxone access and syringe services are shaped at the state level with limited but important opportunities for local action. So given the challenges you described in evaluating municipal laws, what are the opportunities, or rather what strategies or data partnerships do you see as most promising for cities that want to both advance and document local harm reduction policies given the constraint of state preemption?
So you mean just given the state preemption in certain jurisdictions, to what extent is it possible for jurisdictions to have local control? Is that?
Like, what are the opportunities for local governments to document it, to advance and document? What data partnerships, what strategies do you suggest so that they show up in those large language models, right? Because one of the challenges you identified, where they don't even show up. So how can cities, who we represent at the National League of Cities, what are some strategies, what are some data partnerships so that they're documenting the harm reduction policies that they're putting in place at the local level? Thank you.
Yeah, absolutely. So I think it's establishing research partnerships. So partnerships with research groups like ours or others, like the Temple Center. Temple University has a Center for Public Health Law, which is also doing a ton of work documenting a lot on state laws, but increasingly also on municipal laws. And so working together with groups like ours and theirs, I think is a good way to be able to get that data. So for this large language model, we downloaded all the data first from places like Municode, right? And then we used that data to inform the large language model rather than using all the data out in the universe. And so that's the way that we can do it. So we draw on the published data on municipal policies through a range of databases and then use the large language model to extract that data. And I think there's a lot of opportunity to work with researchers to be able to define the questions that we can ask from the data and to measure those policies and then hopefully make that data more publicly available. And that's something that we really would love to be able to do. I'd love to be able to talk more with you in person after.
Can I follow up with a comment on that? Right across the river here, is that where the Schuylkill River is? I don't know if I'm pointing the right direction. There's the Center for the Reconstruction of Economic Data, or CREED, at the Philadelphia Federal Reserve Bank. And I was invited to a workshop there 2 years ago. And they're using large language models and machine learning to extract data from so-called soft data, like scanned documents and things like that, and create structured databases in which you can do analysis. And then this workshop I was at 2 years ago, it was amazing. I mean, I saw miracles. I saw, for example, someone took all the zoning codes in the United States and pulled them out into a structured database and did maps of how zoning varies by distance to the city center for every city in the country. I saw another presentation where someone took all these typewritten driver's license registrations at the county level from like the 1920s up until the 70s. These were all typewritten, but scanned documents, and with 4 commands in a large language model, they were able to fuse 700 tables together into a national database at the county level of license registrations. So there's just some amazing work going on at being able to extract structured data out of historical documents, photos, and things like that. And I think it's, for people working here in Philadelphia, you should go across the river and talk to these people at CREED. But I think in general, we should be working with people who are developing these techniques, because there's a lot of historical data now that's been scanned just for repository purposes and storage purposes. And it's basically a gold mine of historical, health, economic, social data that we could be using very easily now. In the past, it's been impossible because you had to do it by hand, but now the machines are succeeding.
Can I follow up on that for a second? I just want to sort of trace the thread of comments here from like found data are found and questionable through really they were collected with bias through it would be great to be able to do more with them. And I want to land on Harvey's comment that other people are doing more with them. And I think it's an important thing to think about in prioritizing your work and all of our work, that if we come to this with this is going to happen, right? These analyses are going to happen. And so this question of what do we do with the biased data is if we don't look at the biased data and call out the bias, someone else is going to do it, and whether they're going to call out how it was collected or whether it was like how to think about how the social context and the data collection aggregation process feed into the conclusions you can make. That's what epidemiologists bring to work broadly. And if people who are trained to think about systematic biases are not involved in that data analysis, the outcomes, I think, because of my bias, will be worse. And so I would say, don't shy away from the data that are biased, but figure out how to work with them and articulate what's going on.
That's right.
Well said.
That's a really great closing comment, actually. So thanks, everyone. And before we start moving away from our chairs, Claire has an announcement.
Yes. Is this mic on? Hi. After this, we're all heading to the reception. It's in another building called Basone. If you look in your printed programs, there's a map to where we're going. Also, if you go out into the Nesbitt lobby, after this, there will be lots of people heading that way. So just follow the crowd and the volunteers directing you to Basone. It's just really just across the street. And yeah.
We'll see you there.
We'll see you there.
Thank you all.